Hi you guys, welcome to my channel. My name is Anne. I am a nurse here in the Bellevue, Seattle area. I have been a plastic surgery nurse for 2 years and a nurse injector for 1 year. It is my 1-year anniversary as a nurse injector, and I wanted to share with you guys how I became a nurse injector. This is a question that I get asked all the time, and this is a very fast growing field. So I wanted to be a resource for you guys and also share my experience with you guys. I have so many fun things coming up this next year and so many trainings, so many other big announcements that I don't want to say yet. But I wanted to take you guys along this journey with me and be a resource for those of you who are aspiring to be an aesthetic nurse and motivate you guys and just take you along my personal journey. So without further ado, I am going to get started about how I became a nurse injector. So the first thing that I did was go to nursing school. Nursing school is a total of 4 years with 2 years of prereqs. There is 2 routes that you can take. You can go the community college route or you can go the university route. Both years are 2 years of nursing school, and then you graduate either with your RN in Associates of Nursing, which is the community college route, or you'll get your bachelor's of nursing with the university route. After I finished my prereqs in nursing, I applied to as many nursing schools around my area as I could, and I got accepted into a community college. Going to a community college worked out really well for me because I worked full-time and I paid my way through school. So going the community college route is a lot more affordable and worked out really well for me. In 2020, I graduated with my RN degree. From here, there is a bridge program to get your BSN, which is an additional 1 year. And I was planning to go that route until I got pregnant. Here's my little bub. I was planning to get my BSN, but then I got pregnant and things changed. The thing about this field is they don't require you to have a BSN. From my personal experience, everything that has helped me succeed and gain knowledge was on the field and in my workplace. There's really nothing that prepares you in school to become an aesthetic nurse. Even with your anatomy and physiology classes, they don't really focus on the face or any of the medications that you need to know in this field. So everything that I learned that helped me succeed has been through my workplace. And so I never felt the need to get my BSN or an urgency to get my BSN, but that may change in the future. I have other certifications that I'm working on, and for me, I just have not decided to get my BSN. So after I graduated in 2020, during the pandemic, I started to go on Indeed and look for as many jobs as possible related to aesthetic medicine. I applied to everything as far as dermatology, med spas, plastic surgery offices, pretty much anywhere that I could get my foot in the door, I applied to. I applied to many jobs and got a lot of interviews and got denied and rejected a lot before I found a job at a plastic surgery office in Bellevue, Washington. I am so thankful and blessed for my opportunity to work with Doctors in Plenty. What's really unique about the plastic surgery that I work at now is that it's a surgery center. So we have tons of doctors coming in and using our OR. What's really cool is we get to see so many different surgeries from head to toe. The ones that have really helped me in excelling in my career as an aesthetic nurse is seeing those face cases, brow lifts, eyelid cases, cheek lifts, face lifts, lip lifts. Anything that has to do with the face was really helpful because I got to see the skin beneath the surface, learning about the layers, the muscles, the nerves, really just seeing these priceless opportunities and working with so many different doctors and learning about their perspectives, learning about their techniques, and just building those networks that you really can't gain anywhere. I am so thankful for this invaluable experience because just being able to interact with all these different practices and doctors has helped me grow so much as an injector. So the funny thing about when I got hired in my position as an OR nurse is that Dr. Z told me that, this job position is not going to train you to be an injector. And I was like, yes, that's totally fine. I am happy to work as an OR nurse and be in plastic surgery because I knew that this was the next step that I needed to take to become a nurse injector. So I was fine to not be an injector and just put in my time, get in my experience, push it out for a year and just learn as much as I could and absorb everything as a new nurse. After a very long year, I had a talk with my husband and I was like, I really want to be a nurse injector and I really want to ask Dr. Z if I can start injecting. And he pretty much sat down with me, and he's so motivating and encouraging. He's like, this is what you need to say. You're so qualified and you can do this, this, and this. And he just instilled the confidence that I needed to go and ask my doctor to start injecting. So I had a talk with him one day, and I was like, hey, do you think that I can start learning how to inject? And he was so down. He is just the best doctor and boss that I could have asked for. He was like, okay, let's do this. We set up a plan about how I would start injecting, and that included 2 months of me pretty much shadowing him and just watching him in his clinical practice. Anytime he would inject, I would be in the room watching and asking questions. And then we also set up a couple trainings with our reps who give us the filler and Botox products. I had a couple trainings with MERS Aesthetics, a couple trainings with Versa. I went to an Allergan aesthetic training, and then just doing a lot of my own research of reading and watching videos online is what really helped prepare me into my first couple of months as a nurse injector. Along with that, I also had my family and friends who allowed me to inject on them and get a lot of practice. So I'm so thankful for you guys, because that is really scary, getting injected by a new injector, but you really can't get better until you get that physical practice and having that needle in your hand. You can watch as many videos as possible, but there's no experience like actually getting a needle in your hand and injecting a live person. So after 2 months of shadowing and pretty much absorbing in as much knowledge as possible, I started to take on my own patients, and it was all history from there. I've been a nurse injector ever since. What's really nice about being an OR nurse is I was able to easily transition into being a nurse injector without losing too much of that pay difference. I had 1 day off a week that I used to inject, and then as soon as I started to build my clientele, I added on a second day. So I'm still working as an OR nurse, which is really nice because I can supplement my income while I build my practice and get better as an injector. So yeah, that is pretty much how I became a nurse injector. I got my foot in the door by being a plastic surgery OR nurse, and then by building that relationship with my doctor and really showing him how hard of a worker I was and how passionate I was able to transition into that nurse injector role. I am so thankful for everything that has happened to me and how my journey has transpired so far. I have worked my butt off and have just been really focused on getting to where I want to be. This is a sign for all of you aspiring injectors out there. If you guys really want it, you will put in the work and do everything that you need to do to get to where you want to be. I promise you, it might feel like a long time because it's hard not to want things to happen right away, but as long as you have your mindset and you work really hard, you are going to get there, I promise you. So now that you've heard my story, I wanted to give you guys a couple tips that have helped me in my role as a nurse injector. The first one is to start learning and reading as much as possible. Before I was even presented with my nurse injector role, I was already reading and watching as many videos so that I could get familiar with the verbiage, vocabulary, and just the concepts around nursing aesthetics. I think that this just really helped prepare me for when I started to learn about the field and people would talk to me about Botox and aesthetics. Having that foundational knowledge and basics really helps prepare you to start in the field and just excel your learning and put you in a position where you're not starting from scratch. I will leave down below a couple of the books that I used when I started just to really give me that basic knowledge and just really help jumpstart me into my role as an aesthetic nurse. My second tip for you guys is to really familiarize yourself with Instagram and social media. This is going to be your biggest business tool when you become a nurse injector because it's how you're going to bring in most of your business. There's just so much to know around social media, how to edit, how to create content, how to know when to post content. There's just so much to learn about it, and it's such a learning curve. Just really learn how to utilize these tools to excel your business and to build your practice. My tip within that is to start your Instagram now. Really start learning how to use those tools and just follow other injectors you like. Just being motivated by their content and just seeing what kind of content that they're posting is really going to be helpful in your career. And my third tip for you guys is to not worry about the pay. I know that might be hard, especially if you're going in as a full-time nurse injector, but as long as you put in the hard work and you put in the time to become a great injector and perfect your craft, the pay will come later. I know when I was starting out, I honestly did not care what I was getting paid because I was just happy to have that experience. Once you have that experience, you can pretty much go anywhere. So don't worry about the pay now. Just know that with time and practice and patience, the pay will come. I hope that you guys enjoyed this video. I'm so excited to be back on YouTube, creating content and sharing my experience with you guys. If you guys want to see some of my nursing content, you can follow my aesthetics page here, and you can also follow my TikTok if you want to see other content. If you guys have any questions for me, leave them down below and I will answer them for you guys. I will see you guys next time. Thank you so much for being with me today.